Hi, today I am coming on to talk to one of my cousins who is a mom. She's not a mom, she's a mom to be. She's pregnant right now, she's a newlywed, and she's going through, and she's also a healthcare worker, so she's going through this coronavirus right now at a very vulnerable time. So I wanted her to come on and talk about what her experience has been. So I'm asking her to join us. She just needs to request to join, and then we can get started in talking to her and see how she's dealing with all of this during this crazy pandemic time of social distancing and being afraid. So hopefully we'll get to talk to her soon. Okay, let's bring her on. We're going to talk to my cousin Hasina, who is an amazing, wonderful person. And here she is. Hey, Hasina, thanks for joining
Hi,
us.
thank you for having me.
So I was just talking about how you're right now during this crazy time, you're pregnant, you're about to have a baby soon, but you're also a healthcare worker and you're a physician's assistant. I don't know if you're working, and maybe you can tell us a little bit about how you've been dealing with all this, but you just got married. And so I don't know, is this all bringing up a lot of thoughts? And so that's what I want to talk to you about. So
Yeah, absolutely. Yeah. Yeah, my name is Hasina Mojaddidi, and I'm a physician assistant based in Walnut Creek, California. Yeah, to say the least, this is a little overwhelming, right? Everything is new in general, but on top of that, everything is new with this entire, coronavirus going on too. So it's been a little bit overwhelming. It's a time where usually you want your family to be involved, your mom, your sister, your brothers, all these people, but you become a little limited, and you become a little, you start realizing that all those things you used to have access to are now kind of not there anymore. So you take things for granted. So yeah, it's definitely overwhelming to say the least.
yeah, and being like, when is your baby due?
So I am 33 weeks pregnant right now, almost 34 weeks. So I'm due in early May.
Oh,
So
wow.
my husband and I are, constantly talking about how it's going to be once the baby's actually, coming. So hopefully by May, we hope that it kind of calms down a little bit. But if it doesn't, at least we're a little prepared. But yeah, I'm due in early May.
So I know that today is my daughter's 15th birthday, and I remember how as much as I had anxiety in the past, I was not necessarily OCD or a germaphobe until after she was born. But now with everything going on, I'm sure that's triggering you in a lot of ways with making sure everything is sanitary and clean. And then after the baby comes, it'll probably be even worse.
Yeah, for sure. Yeah, my husband went grocery shopping yesterday, so he brought on all the groceries. And I mentioned earlier that I was cleaning the milk gallon with Lysol wipes and making sure we're actually doing the surgical way of opening things. So when a box comes in, we leave it, and then we put gloves on and we open it so that things can fall out. And then we like make sure to clean that. So yeah, I mean, I was already a little OCD before. Now it's even worse, and it's probably, like you said, going to progress even more once the
Mm.
baby is here. But you have to look at the silver lining too. I mean, maybe this is going to decrease overall colds and disease in the future. Who knows? So, we're hoping for the best. But I would have never thought that when I was having my baby or getting prepared that it would be like this. But it makes you kind of realize that at the end of the day, it's you and somebody above. You have to have your faith in.
I think that's what I learned. And I think that's the best thing I did was to just, what do they say? Let go and let God. And just, you have to know that before you have the baby, you kind of are in control. Like, I love the fact that she was in my stomach and I could control what I ate and I could protect her. Once she came out, it's like, nothing is in my control. And it triggers a
Exactly.
lot of fears and worry, and especially irrational thoughts. And you just can't
Exactly.
drive yourself crazy with that. You have to just let go and pray for the best and hope that they're going to be okay.
Right. I think one of the most shocking things that, for the most part, I feel like I've been able to take care of like this whole situation pretty well, have my feelings under control. But I went in for one of my prenatal visits, and the doctor mentioned that, hey, you're only going to have one designated visitor for the entire time you're
Oh,
there.
wow.
On top of that, they said that designated visitor might not even be allowed by the time you have your baby.
Wow.
So you might be by yourself. I was like, oh my God, so this is all coming to me at once. And then on top of that, they were saying that if everything goes well, you'll be in and out really quickly. So we're going to bring you in and then take you out. So I was like, maybe I should do home delivery. Maybe I should just go
This
buy
is a
one of
good
those
time.
tools, you know?
This is a good time. Get a
Yeah.
doula.
Yeah, no, seriously, I could consider that. But, you know, for all the pregnant women out there, though, I think this is you have to be positive, and you have to kind of just be like, you could tell your child this when they're born and be like, do you know what I went through for you? Because, you know, my parents would always be like, I walked this many miles for you and blah, 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 you know, all these classic stories. But it's true. And we actually still have it way easier than what they had. So it's definitely a story to tell. But, you know, everything is perfectly planned. And you have to just trust that this is where you know, are at. And you have to trust that, you know, how strong of a woman you are. This is representing that, you know, maybe this is foreshadowing that you're going to be even that much of a stronger mom in the future, you know? So
well, it
be
is
strong
like
out there, woman.
Exactly. It's a tough time because, like I said, today is my daughter's birthday and we can't go anywhere. We can't celebrate. It's just a very small celebration. And then for you, I'm sure baby showers have been affected. You're not, there's not a lot of gatherings and get-togethers because of everything that's happening. So how are you feeling with that?
Well, you know, we were planning to have the baby shower and that was canceled. And it's more so because you want to share this blessing that you have with other people that you love. And it's not something that could really be postponed, you know? So, hey guys, this will be postponed for the next few months, but who knows? Maybe the new trend will start. But I mean, again, you have to put your trust in God. And that's really what's putting me forward, because especially if I go through delivery by myself, what an amazing thing. That's like the ultimate connection, right? But I think it's initially it was a little hard to hear. You get a little sad, you get a little down. I had another baby shower with family, and then I had baby shower with work, and they both had to be canceled back to back. But you know, what are you gonna do? It becomes out of your control, and maybe that is saved for something in the future for you, or in the future for your child. And you know, so you just have to stay positive and just be like, this was how it was supposed to be, and maybe I'm saved from something, you know. So
Right, and we actually are more appreciative of the things that we used to take for granted. This is forcing us to really appreciate the time that we do have with our family and the connections that we do have.
absolutely.
Somebody was telling me today that they had a virtual birthday party, and so they all called. They did it all over FaceTime and Skype, and they just kind of celebrated that. It's like, that's so sad.
Yeah.
But that might be the future, that we all just got to get together virtually and celebrate.
Right.
So
Right. I think the hardest part for me right now is how long is it going to last, right? Because there's not really. I think that's how everybody's feeling, but especially, you know, when you have a newborn, you know, with you, you're just like, okay, it's going to be so different. Now you're even scared. Should I even go on walks with my newborn? You know, that's something that a lot of new moms do to kind of get through it. But that's probably the scariest part. When is it going to end, and how is it going to be with a newborn? Especially because you hear people all the time like saying that they have to take their baby to the ER or something, God forbid, if they need to. That's really not an option right now. I don't think it would be the wisest thing. But yeah, I mean, it's just kind of scary to not know the ending. But at least we have FaceTime. What a blessing that is. At least we have, you know, this connection. You know, we didn't have this years ago. So that's also a blessing too.
yeah, I mean, it's a crazy time, but amazingly, I've heard that babies are not necessarily being affected, thank God. And so that should give you some peace of mind.
Yeah, that's a blessing. I've heard women who are pregnant can pass the virus to the baby possibly, but usually so far with limited studies, it's shown that they haven't. But that's why I'm extra cautious. I really don't even go out. I do just a walk a day just to stay sane. But other than that, yeah, that's good news that it doesn't really show it's affecting children at this time. But you're still kind of scared because you're like, will new research come out saying, wait, actually it does, you know? So it's just better to, like, you know, have your precautions and whatnot.
So as a healthcare worker, as a physician's assistant and a medical worker actually working in the medical field, you know how they say graduate students or medical students that every disease that they read, they think they have? Yeah. I mean, being pregnant right now with your hormones and everything, is this really affecting your thoughts? And maybe are you allowing those negative thoughts to creep in?
Have I thought I've had it once or twice? I think as everybody has, but for the most part, I feel like I'm in a safe net because I don't go out as much. But I'm sure once I become more active in society, and obviously this isn't going to go away overnight, I'll probably be more prone to that, you know. But in a way, it's a blessing too when you are a little bit more well informed. You know, hey, look, I don't need to worry about this.
Worry as much.
Yeah. If anything, I'm doing televisits with my patients, and a lot of them are really scared, and they're asking me a lot of questions, usually not relevant to us because we're a specialty clinic, but they're asking us a lot of questions. Hey, I'm having this, you know, sore throat. Do I have, you know, do you think I should go get a test or whatnot? So I'm glad I can still give back in that, you know, primary care setting. But yeah, I feel like everybody's kind of on that, especially pregnant women out there. But we kind of just need to stay calm and well informed and kind of go by that, you know.
Yeah. Are you how are you working right now? Are you just working from home and not going into the office? How has that been?
Yeah, thank God. Our clinic is we treat a lot of chronic pain patients. So we do have a lot of patients who are dependent on us, whether that be on their medications, because a lot of them are on medications and they need refills. And then a lot of them are also a lot of workers' comp patients who need like work statuses, who are very dependent on certain statuses like once every month. So we are still active, but thank God our office is closed. We have like a skeleton crew there, but we're doing mostly everything remotely, which is nice. So it's good timing for me because I actually extended my leave by 2 weeks because I'm like, you know, it's better to work than go crazy at home, right? So that's been a benefit. So I've extended it for 2 weeks. Our employer and our people at our work, they're pretty accommodating, which is nice. So
what do you mean? You're going to work an extra 2 weeks, or you're going to?
I'm going to extend my leave, so I'm going to work an extra 2 weeks. Yeah, so I'm actually working till May 1st, which is kind of pushing it.
When is your due date?
Considering my due date's May 11th, but
oh wow,
that's okay, you know. It's all right.
I think I remember going like 2 days before my due date, going to a conference and driving across the bridge, and
nice.
so yeah, we do.
I know. You gotta do, especially at this time. What am I gonna do? Like in my mind, I was like, I'm gonna go run errands, have lunch with friends. No.
Yeah, no, I think I would have driven myself more crazy if I stayed home and didn't do anything.
Exactly.
So,
you want to stay busy for sure.
Yeah, as long as you're healthy, and that's what. Are you focusing on making sure you are eating well and getting enough rest and doing all that?
I could probably be better at that. No, yeah, pretty much. No, I think shockingly, my water intake has decreased. But yeah, I think we got to stay hydrated. But yeah, for the most part, you have more access to, you know, drinks and staying hydrated and whatnot. So I'm trying to, but sometimes at home you kind of do less than what you would at work. It's kind of interesting, but who would have ever thought I'd want to say I want to go back to work? So
no, I think the blessing of it is a lot of people that normally wouldn't have had a chance to stay home and take care of and do the things that they needed to do, or even for you to rest and slow down. This is giving you that opportunity, which is great.
Yeah. A lot of my fellow PAs who've already been through pregnancy and have babies, they have told me, you know, this is actually kind of great timing for you because you can work more and not have from the, you know, comfort of your own home. So that is actually another silver lining that I'm trying to stay positive about. So who knows? Maybe this is the best situation for a lot of us in certain ways that we don't know yet, you know?
Right. How are you with like going to visit family members, and are you afraid of people coming over and talking to you, or going over to see your mom or anything?
Yeah, I don't like, I live pretty close to my mom, so we usually walk and we meet up in the middle and we take a walk. We stay 6 feet apart. But,
no kisses, no hugs.
Yeah, no, I know. That makes me kind of emotional because when I see my mom, you want to like embrace them or whatnot, but you can't because you're like, you don't want to put them at risk,
right.
Put yourself at risk, obviously. But no, that helps seeing them, you know, once in a while. But I've become a little bit more like my brother came to drop something off. I was like, hey, all right, just leave it. You know,
so, don't even come to the door.
Yeah, just, you know what, just stay down there. So
don't even park, just leave it and go.
Yeah. So I've become a little bit more, you know, cautious, as everybody has. You know, I'm sure a lot of people aren't having visitors and stuff, but hopefully, like I said, I hope this is temporary and we all get through this together. And I really think it's going to make us so much closer, all of us, you know. So I'm excited to see family and embrace them, and, you know, once this is a little bit more calmed down.
Yeah, I hope so. And then just working in the medical field, I know you do pain management, but going back to work with a new baby, do you have any concerns with that?
Yeah, it really depends on what the status of this whole virus is, right? Because the thing with our patients is that when we stay open, these patients will deny that they're feeling sick, even if they are,
Mm,
because some, for example, are on opiates and they need their medications every 4 weeks. So
mm,
if they don't come in, they will not get their medications. So a lot of them will say, "Yeah, I'm not sick," and then they'll be visibly sick. So that's why these telephone visits are so nice. But yeah, that's the thing. When I go back and I have a newborn at home, who knows? Maybe I might even stay home longer than anticipated if it's still a threat, because I would never want to bring that home with me or expose myself. So yeah,
yeah.
it just depends. If it's still kind of active, I would probably not go to work as soon as I anticipate. So, but you
But
have to
also,
eventually go, right?
well, one thing that we're learning is that all those people that wanted to work from home, now they're realizing that that's possible. So maybe that
Yeah.
can be an option for you until maybe, I don't know, until the
That's
baby's
true.
a little
They
bit
they have
older.
thought they have thought about implementing remote visits and whatnot. And being a physician assistant too, you have to understand that, or a nurse or a physician or whatever, you have to understand that this is our duty, right? To put ourselves in the front line and kind of treat our patients. However, I think if there is a way to protect the employer and the patient by working remotely, it should be implemented. But hats off to those people in the ER. And I know you interviewed Dr. Mojaddidi the other day, and that's absolutely amazing what he's doing, because he's risking himself, right? And then he's risking his loved ones and his immediate family. So, um, yeah, so good for them. But I think if there's a way to work remotely, it really should be implemented to not only protect yourself, but more so for the patient and their family.
Yeah, no, it's just crazy times right now. Any fears coming up for you?
Yeah, for sure. I mean, I'm trying to definitely not get sick while being pregnant, because of that risk of possibly transmitting it to the baby. But once the baby's here, I think my fear is that I'm going to become scared of people. Like that is actually kind of more scary than some of the other things, because now you're so aware of everything that it's like I feel like you're already like that as a baseline mom, new mom,
Hmm.
right? You see a new mom, especially for the first baby, they're like,
Hmm.
hey, don't do this, don't do that. But on top of that, I'm going to become even more OCD. So my fear is that I hope I don't become more OCD than, which is probably going to happen.
I
But
think you should just accept the fact that you will.
yeah, I know. I know. I
It's
think we can
okay.
only take so much caution. So, and there's other fears too, aside from the baby. I mean, there's job security, right? So it's like,
Mm.
you want to make sure you have something for you, because you don't know where this is going to go. You don't know where the economy is going to go. And then on top of that, you have a new baby with all these new expenses, and you're like, oh my God, So that's another fear too that, I think all of us are kind of feeling. But again, you got to just put your trust in God and just move on and take one day at a time.
That's all you can do. No, this is different, challenging times, but I know just the anticipation of even without this virus, without any of it, you're about to have a baby. I mean, your life is going to change forever. I'm sure there's thoughts that are coming for you, just coming up that have nothing to do with the virus. Just the anxiety of being a new mom. How am I going to
Right.
do it? How's the delivery going to be? And then you're going to be all by yourself in the delivery room,
I
possibly.
know. I
That's
know. I know. I can't imagine. I was like, we were trying to come up with a plan. I'm like, okay, if you can't be there, I was talking to my husband. I was like, if you can't be there, we'll just put a phone or laptop with FaceTime. You be in the parking lot. It'll work out. But, like my sister, she went through a C-section, and Nazir went through a C-section, and she had some adverse reactions to the anesthesia, and we had to
oh.
really vouch for her and voice our concerns. So to imagine being really all alone, it's not really going through it. I mean, yeah, that's kind of an issue because you don't have the support that you would usually have. But it's like, what if something goes wrong, right? So
Mm.
who's gonna vouch for you, And especially if these people are more like cautious about treating a different thing that's more serious. It's just scary. I could go down this road of like having these thoughts, but again, what are you gonna do? It's out of your control. So I just hope that by the time it comes, a lot of this is lifted and we can kind of become a little bit more normal again.
Well, one thing that I did to kind of make me feel a little more in control, I mean, first of all, I had like, I think 30 people in the room with me, which was ridiculous. I can't even believe that all those people were allowed to be in there. But second, I had a very detailed birth plan that I wrote. And
Hmm.
so I wrote everything that I needed to happen in case of emergencies. And I just like, I think you look it up online and they have these pre-written templates that you can follow and then you add your own and you
Oh,
make sure
nice.
the doctor has that and that you're speaking for yourself.
Right.
Because like you said, things can happen. And if there's nobody there,
Right.
who's going to speak for you? But you need to write all of that stuff down. And that made a huge difference for me to get a sense of control about what was going on.
Right. Yeah, no, absolutely. I think that's a great idea. And surprisingly, I haven't really sat down and really done that. It's been on my to-do list, but that's a great reminder because especially like you
Mm-hmm.
said, when you're alone, you have to have a voice that is there, even if it's your
Mm-hmm.
own. Especially when you're in a state of, labor, you're not going to know what you're going to be thinking. So
Right.
it's good to be in control. So yeah, no, that's an excellent reminder. Yeah, I got to do that.
And I would be totally, even if your husband's not allowed to be in the room, he better, that phone line better be open in case anything happens. Yeah, because it's like you guys are doing things differently. This isn't the olden times when you could just, he can be downstairs smoking a cigar while you're giving birth. He better be, he has to be involved.
That's very true. I know. You better not be telling me he's there when he's really not. Be like, show me the parking
It's
lot.
like he goes to a movie. Yeah,
I
chill.
know. Be like, that looks like our couch.
Yeah, you're doing a great job, Hasina. Keep doing
I
it.
know.
Wow. Yeah,
Yeah.
I mean, I wanted to talk to you about just how vulnerable a position you're in being pregnant and facing the future as a new mom, as a new wife, and then working because you just graduated too a couple of years ago. So you're new at
Yeah.
your job and it's just a lot of new things, like you said. So,
A lot of new
um,
things. Yeah. A lot of peaks and valleys, right? So you have this peak of finding out you're pregnant, you're having a baby, and then you have this down, so it's life. But I think I've had so many changes for the most part for the good. So I'm so thankful that, I have all these things going on. But um, it could be worse. We could have gone through like a major war, God forbid, or, whatever. But um, yeah, you just kind of have to take one day at a time, and you got to just be smart about it and sane about it, and just trust the one you believe in. So yeah, there's definitely anxieties there, like I mentioned, but I got to just kind of relax and take it easy and one day at a time.
all week I've been kind of trying to promote self-care and trying to like, I know as an anxiety specialist, I'm just focusing on helping people manage their anxiety and dealing with what's coming up. And I know this is triggering a lot of people's anxiety. So how are you like focusing on self-care? How are you taking care of yourself right now just to make sure you're staying safe and balanced and healthy mentally,
Yeah.
physically, emotionally?
Well, luckily before this whole outbreak started, I was walking every day. We have a nice trail next to my job, so we have like a relatively longer gap throughout the day. So I would walk like 2 hours or an hour and a half a day,
Mm,
and it would make me. And I would do it not only for my health and the health of the baby, but it would just kind of relax my mind, right? So it would
mm-hmm.
it would allow me to escape, be closer to nature, even though Um, it was right next to my job, but it was a trail, so I got used to that, and it really helped me. So thank God I'm still able to do that because,
Mm.
in this situation, I can easily go out and walk. I have a park pretty close by to my place, so I go there. I do 2-3 miles a day, so it's
Wow.
nice because it makes me stay relaxed. Because if I didn't have that, or if I got used to, like, let's say the gym, I would have been kind of, I would have had an issue with it. Or let's say if I had something that I did that was not allowed now, it would have been really
Right.
hard to deal with. So that's one thing that I do. I do take walks. Another thing I do is me and a couple friends, we do like FaceTime, talks, and kind of just talk about our feelings and whatnot. So that helps too. I think the biggest thing is to just try to stay as on schedule as you can, because sometimes, working from home, it's easy to um, get lost, right? And I've been
Mm-hmm.
guilty of this. I've been in my pajamas at like 1 o'clock, still calling patients, and I'm like, oh my god, I should go change, right? Because it's, so there's a wisdom behind that to kind of keep a schedule. So I'm trying to also keep a schedule, trying to make
Mm-hmm.
dinner at the same time. I
Mm-hmm.
made some things that I've experienced that I've never tried before, and they came out decent. Some not, better than others, but I think that also helped me with it. So, you know,
Yeah, routine is important, and I like that you're cooking at home and eating healthy foods.
yeah.
One thing that I know helped me a lot during delivery was having a meditation practice before the actual delivery. Like, I remember when I was in my early 20s, I started learning about guided meditations and muscle relaxation and breathing exercises. And because I was doing it in my early 20s, it's amazing when I actually was in the delivery room, just practicing those breathing exercises made a huge difference in helping me deal with the contractions to the point that I didn't even need any epidural or any medication or anything. So I think starting that now before you're actually in that situation, because your muscles have memories. So once you learn how to relax and calm your body, you can use it in difficult situations, whether it's giving birth or in a panic attack. Practicing that breathing exercise now would be really important. So
yeah, no, that's an
so you have
excellent piece of
time.
advice. Yeah, no, that's, I've been actually wanting to implement that in my daily routine as well, to try to prepare myself, because you don't know, how it's going to go. But if you just plan and prepare your body, that's huge. And it's, a lot of it is mental health, a lot of it's physical health. So I think that's a great piece of advice for sure.
Yeah. I mean, I know that finding meditation videos and stuff is really difficult. If you want to join my 21-day guided meditation challenge, it's free, but you can go to drsekandarycourses.com/meditate and just sign up. And every day you get a different type of meditation. And what I like about it is I've collected a bunch of different types that I like there's breathing exercises. Like it starts really simple, breathing, muscle relaxation, and it goes into visualization. And then there's also tapping. So I don't know if you know much about tapping, but it could really help as far as even with pain management. There's certain points in your body that are like acupressure points that you can tap on to relieve anxiety or even pain. And so
Wow.
I'm talking about tapping in there. I mean, or not talking about it. I mean, I have videos to teach people how to do tapping. There's Qigong, which is a moving meditation, which I love. It's very simple. I think it's something you can do now being pregnant. It just
Great.
creates mindfulness and gets you in your body. And I think right now, as you're preparing for delivery, these are great things to start implementing.
Absolutely, yeah. I mean, I could definitely benefit from that. So can my patients, because we offer a lot of acupressure, acupuncture, and do have a lot of patients who have mental health issues, right? So they have a lot of anxiety, a lot of depression, panic issues. So that might be really beneficial as well. So I think everybody can benefit from it, especially an expecting mom and my patients. So I think that's a great thing to know. Yeah, and also with the whole pregnancy, all my classes got canceled. Like the ones at Kaiser, I have Kaiser, and they offer you
Oh,
classes like
wow.
breathing classes, birthing classes, breastfeeding classes. And that was kind of hard, even though everybody's like, oh, you don't need those classes, they're not that important. But
You
I was
need
like,
them.
those are really important to me. And maybe people think it's not as important, but I was really looking forward to that. So all of that got canceled as well. So, I mean, I'm glad we have these options of like, the sources that you offer or the sources that other people offer. But now it takes an extra effort to seek those things out. However, I'm glad you shared what you shared with me, because now I can, look into that more too. So thank you.
I think you do need them. I mean, people were telling me the same thing, and I was like so by the book during the entire pregnancy and delivery. I mean, I was doing all the wiggle, 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 and all the stuff that you're supposed. And I learned all those in the classroom, and then the breathing exercises. You do need them, and
But you did
it's
what you had to do, that what your intention was, and you did that, so that's
mm-hmm.
huge. So it does make a huge difference for sure.
I think
So
so. I was so determined that I was like, there's no way you're going to give me medication or give me a C-section. I'm doing this my
I
way.
know.
So I was pretty determined. So that motivated me to try these other things. I had oils in my delivery room. I had classical music playing. It was kind of a
Nice.
joke, but
No, I'll be right there with you. Don't you worry. Every suggestion helps.
yeah, I was that hippie mama. I mean, all I was missing was a water birth, but
I know.
everything else was there. But anyway, I mean, all
Yeah.
that stuff works and it does help. It creates that peaceful mind because delivery is very hard on your mind and your body. So you need to create as much a sense of peace and balance and
Absolutely, yeah. And
calm.
one thing I did hear, which I don't think is necessarily true, but somebody was mentioning that the hospital is actually really highly recommending against epidurals and possibly not giving any. Which every new
It's
mom, I
about
think,
time.
I hope that I don't, I go in there. My intention is to not do that, but they were saying that we might actually ban it because it elongates the labor and delivery, so you're going to be more exposed to this virus. So we're not giving it to you. So I was like, that would be hard though if somebody was in a lot of pain and really needed it. But we're going back in the day, so we'll see how it goes.
I kept thinking the whole time about those women that would go tend the fields and then come home and squat and give birth. And then the next day, you know, they're rest a couple of days and they're back at work. I was like, if those women can do that, I can do that.
Exactly. You know, and that's another soothing thing and comforting thing for me is that, you know, women generations and generations have done this for years, right?
Mm-hmm.
So what makes us think that we can? We've come so far that what makes us think we can't do this, you know? So that's my intention. Maybe we'll have a post-delivery interview and I'll be like, hey guys, yeah, that wasn't the case.
It was all a lie. Get the epidural.
I know. Epidural and then C-section and then it just went down.
Just knock me out. Wake me up when it's done.
I actually scheduled it, but yeah, I mean, that's the thing. You have to, you know, remember, like my mom, she's had, you know, a lot of our moms who have given birth to a lot of us in, you know, third world countries, they didn't have this, you know, and like you said, they literally were like sweeping the floor, felt a contraction, gave birth, and came back in the corner of the living room, you know? So.
But that's what I found out, that all those things they did is exactly what you need to do to have a safe and healthy delivery. Like even sweeping the floor, or not sweeping the floor, but scrubbing the floor and that wiggle action that you get, that is what you need to move the baby and turn it. And so I had no idea, like we're so comfortable, we're sitting back, we're lounging, we're not doing the things we're supposed to, but that's not preparing our body.
That's very true. Yeah, exactly. I was talking to my mom and I was like, yeah, I just came back from my walk. And she's like, you went an hour ago. I was like, I know. She's like, you can't do that. You need to relax. It's not good. That this is what we used to do in Afghanistan. This is why it was so bad. I'm like, but look what your outcome was. You had us naturally. You were bounced back pretty quickly, you know? So.
Well, they were younger too, so it's not fair, but.
I know. That's another thing. I'm like, we'll see how that goes. But yeah, right now, baby is kicking. He's saying hello, but yeah, he is head down. So when I talked to my OB, she did say, hey, you know, make sure you continue to walk because you have the possibility by being stationary that the baby will come back up. So you want to make sure to do that. So. And that was another thing too. When I saw my doctor, it was a very awkward visit. Just as a side note, she had a mask. I had a mask. It was so, you know, disconnected, very awkward. We weren't sharing pens. I was 6 feet away when I made my follow-up visit. It was the most bizarre thing I've ever experienced, and nobody else was there except like 2 other people. So that's just a side note. That was another crazy thing, but yeah.
Wow, you're like you have stories to tell this guy when he's finally comes into the world, and let him know. Look what mom had to go through for you.
Exactly. I'm gonna obviously make it more dramatic so you can, you know.
That's right. I had to do it walking uphill barefoot.
That's a good one.
Even though he's born in May, say it snowed really bad in the Bay Area too.
In California, that's right.
Yeah, well, I'm wishing you a healthy and speedy delivery and an easy, smooth delivery. And you have how many weeks? A couple more weeks, 6 more weeks to go?
I have a little over 6 weeks. Yeah, so it's going pretty fast. A lot of people are saying that the last few weeks are the slowest. So we'll see how that goes. But honestly, I can't ask for any more other than a healthy baby and
inshallah. Yeah, just focus on, seriously, start that breathing exercise and do the relaxation. It's a good time to do it.
Yeah, I absolutely will. I got to get some oils too and be like, I got to put these on. Tell me relax during the whole session. So
yeah, let me know if you need help with the oils.
Thank you.
I did a couple of videos on my IG videos. I don't know if they're the one. There's 2 of them. One about just boosting your mental health. I mean, boosting your immune system. And then I have another one on just the introduction to oils. So if you need any information, let me know. I'll be happy to send some your way.
Yeah, absolutely. Yeah, anything that you guys think are good resources, please let me know. Everything's welcome. Thank you.
Okay, well, so good talking to you. I just wanted to make sure that everything's okay on your end. And then I'm sure there are other people that are concerned like you are, or they're going through what you're going through, pregnancy, all of that.
Yeah, I think we're all going through something together, but especially for all the pregnant mamas out there, I think if we just continue to focus on the silver lining and just, you know, this is such a learning experience. It's such a unique experience that we're going through that we'll get through it, you know, as everybody else will, inshallah, God willing.
Yeah, let's all focus on the positives. Yes. Well, thank you, Hasina, for joining me. We'll chat again and take care and send my salams to everybody in your family. So that was my cousin Hasina that's going through a pregnancy and 6 weeks delivering and going through this social distancing and missing out on baby showers. But I just wanted to share her experience and let you guys know that it's a real thing we're all dealing with, and to reach out and talk to people and talk about your frustrations and your fears and not keep it in. This is not a good time if you're pregnant to suppress feelings and emotions. It's also a good time to start doing the breathing exercises and the meditation. Again, that if anybody's interested in the guided meditation challenge, it's a 21-day challenge. It's free. If you go to my website, drsekandaricourses.com/meditate, every day you get a different link to a video that's a different meditation. So my goal is to introduce you guys to many different types of meditations, and hopefully you'll find one that actually you like. I get bored really fast with meditation, so I want to try different things, and I want to expose you guys to as many different types so that you find one that you really like. And hopefully you'll find one that you can stick with and try, because I think those breathing exercises are really going to help if you're a pregnant woman and going through, expecting to deliver soon. It'll definitely be helpful to start now. So if you guys have any questions, or you have any concerns, or you'd like me to talk about other things, just go ahead and feel free to DM me and let me know. And I'd be happy to create videos and content for you or share information with you. But in the meantime, we'll talk soon. Until next time. Okay, take care. Have a good night.